Imagine being a patient, you going through chemotherapy, and you never needed it. Never. It was all a fantasy. Put it up full mass. Patient endures 9 years of chemotherapy for cancer he never had. Let me take you to Montana. A man endured 9 long years of chemotherapy for pre-leukemia that he never had. The man pictured here is Dr. Thomas C. Weiner, the doctor who falsely diagnosed him. Anthony Olson wanted a career, children, and a partner despite a diabetes diagnosis at the age of 4, anemia, a kidney transplant that failed at 29, and dialysis. He clung to those dreams. That diagnosis changed the direction of my life, Olson, now 47, says. All of that was taken away in early 2011 when an oncologist at St. Peter's, Helena's only hospital, diagnosed him with a disease, a blood disorder that's often described as pre-leukemia. The life expectancy of MDS patients is short. Quote, he told me that without the treatment, I would be dead before the end of the year. Olson said. He was 33 at the time. Olson could not have known that he was one of many patients who, according to court records, may have received inappropriate or harmful and unnecessary treatments from the good, not good doctor. As reported earlier this month, administrators at St. Peter suspected the doctor who directed the hospital's cancer center. They suspected him of hurting patients for years. Yet hospital administrators allowed him to keep treating people until late 2020, when they suspended and fired him. Dr. Weiner has denied all allegations. Quote, I trusted that he was doing what was best for me, Olson said. I never really questioned that until someone else told me that there was a reason to. I discovered Olson's story in records related to ongoing legal disputes between Weiner and St. Peter's. I was struck by how similar his cases was to that of another patient, same doctor, Scott Warwick. The doctor had diagnosed Warwick with stage 4 lung cancer and treated him with chemo and other therapies for 11 years, court records show. After Warwick died in 2020, his family learned from the autopsy that he never had cancer. Weiner insisted that Warwick had cancer all those years, and other doctors missed the disease. After he was diagnosed, Olson dropped out of college, moved back in with his parents, and began the prescribed regimen: 4 straight days on chemo, 4 weeks off, repeat until he died. Olson endured this for 9 years. Early in his treatment, tests show the chemo had worsened his anemia. Dr. Weiner placed him on weekly iron-rich blood transfusions, something else to pay for, over months, and then years of chemotherapy and other treatments. Olson bonded with the doctor and the staff. He thought of them as friends. As the iron levels in his blood continued to rise, the cancer center nurses began calling him, quote, the Iron Man, end quote. I thought he was helping me, Olson said of the doctor. I actually felt pretty fortunate that we had such a gifted doctor in such a small community. In 2016, Dr. Robert Leclerc, the kidney specialist who was managing Olson's dialysis, became concerned. After hundreds of blood transfusions, Olson's body was suffering from iron overload, which can destroy internal organs. It could have killed him. In December 2020, St. Peter's, the hospital, finally fired Dr. Weiner. accusing him of, quote, harm that was caused to patients by receiving treatments, including chemotherapy, that were not clinically indicated or necessary, among other allegations. Now, I want to stop you here because remember, the hospital suspected he was hurting patients for a long time. Okay. And based on the allegation from the hospital, he gets fired due to the fact that the tests don't indicate the treatment. But where's the oversight? Where's the accountability? There's more. After the doctor was gone, Olson received another biopsy, which came back negative. St. Peter's also retested the sample from the first biopsy. It too showed he never had MDS, despite overwhelming evidence that the doctor misdiagnosed and improperly or illegally treated Olson. LeClaire felt he couldn't just say, Dr. Weiner did this to you. Records show many of the patients bristled when told to get a second opinion or became hostile at the suggestion that the good, not good doctor mistreated them. After receiving chemo through his 30s and into his 40s, Olson's cancer treatments were stopped in 2021. For Olson, the acknowledgement that he didn't have cancer for 13 years, too late. 2022, he sued St. Peter's for malpractice. The hospital settled and paid an undisclosed amount because the doctor was an employee of St. Peter's. The doctor himself was not held liable. No longer overloaded with iron or receiving chemo, Olson became eligible for a donor kidney in the summer of 2023. He got one. He continues to struggle with an array of health issues, but he knows there's a chance he can live into old age. Talk about sick, sadistic, a system of corrupt individuals who, according to the reports, knew or should have known that this doctor was abusing patients. And no protocols are established in order to check and double check test results. How does a doctor do this without other people being involved? I have to question that because typically a doctor has to rely on a physician's aide, has to rely on nurses, nurse practitioners, techs, those who do the laboratory tests themselves. It's an entire company. How does one doctor do this by himself? It's no way possible. All right, Sharon, after seeing this story, I went back in my mind so many times about how this could possibly happen in this era of medicine. And it's just no way possible one man could have done this without the help of somebody.
It happens with permission, negligence, permission, all of that, all of the above. This is, as you said, so sick. It's cruel. It's torturous. And everybody knows, or at least things get around in a hospital, in a newsroom, wherever. Somebody, many people knew, and nobody stepped up. This is criminal. Sure, he deserved money, this victim, but this is a criminal act that others had to be affected by too.
Yeah, definitely. All right, we'll bring you updates if more stories develop.